With that being said, I'll go ahead and turn this over to Presbyterian Healthcare Services Medical Director, Dr. Denise Gonzalez.
Good morning, everyone, and thank you again for the invitation to present today. At Presbyterian, we have 130 patients with COVID across all of our facilities. We've been able to increase bed availability by repurposing some areas that have low census and shifting some patient rooms from being private to semi-private. We've reestablished our outpatient antibody infusion clinic so that we can help to keep patients out of the hospital by them not needing to be hospitalized. As shared on the state's data yesterday, we do continue to see a divide between the vaccinated and the unvaccinated. It is the unvaccinated who are getting sick enough to require hospitalization and mechanical ventilation and needing ICU. And while it looks like the cases are plateauing, we know that hospitalizations will continue to rise in the subsequent days, but there's still plenty of time to make the right choice and to get vaccinated. You might have had doubts before and you wanted to wait and see, but please stop waiting. It's okay. Act now. Please get vaccinated. Thank you.
Thank you, Dr. Gonzalez. Next, we'll go to UNM Hospital Chief Quality and Safety Officer, Dr. Rohini McKee.
Thank you, Mark. Good morning, everyone, and thank you again for the opportunity to speak with you. At UNM Health, we continue to function at above capacity for both our floor beds and our ICU beds. We are seeing a lot of sick patients, both with COVID and with other conditions. And because they are so sick, they are staying in the hospital a little longer than we would normally expect. We remain extremely grateful to our frontline nurses, pharmacists, respiratory technicians, and providers who are working tirelessly and really unable to get a break long enough to help them recover from what seems like an unending ordeal for them. We are also grateful to all New Mexicans who have done the right thing and received the vaccine and are trying to lessen the burden on healthcare workers and keeping our community safe. 371 million doses of the COVID vaccine have been administered in this country alone, and more than 5.35 billion shots worldwide. The safety and efficacy of these vaccines are now without question, and we know for a fact that most deaths and hospitalizations are preventable with these vaccines. So once again, I will end with a plea to listen to science and not get swayed by misinformation, and let the science guide you in your decision to protect yourself, to protect the community, and to protect your healthcare workers. Thank you.
Thank you, Dr. McKee. And next we'll go to Loveless Chief Medical Officer, Dr. Vesta Sandoval.
Good morning, and thank you again for the opportunity to be able to speak with you. As you've heard from my colleagues, the hospital systems are still above capacity, still very full. Many patients, COVID and otherwise, that are quite ill that we're taking care of. And as you've also heard, our healthcare workers are doing the very best that they can given the situation. We are all working very hard to take care of our community, but we need help, and we need help from the portion of the population that hasn't received a vaccine yet. It is safe, it works, it will prevent you from severe illness and being hospitalized. Please go and seek out the vaccine. This is how you can help us. This is how you can help your community, protect yourself, and protect your family. Thank you.
Thank you, Dr. Sandoval. And next we'll go to Christus St. Vincent Regional Medical Center Chief Medical Officer, Dr. David Gonzalez.
Thank you very much for having us. We're very busy here at Christus St. Vincent as well. Our both med-surg capacity and our ICU capacity is greater than 100%. We currently opened up our clinical decision unit to house more patients. Our COVID census this morning is 13, and thankfully none are intubated. Our age range in our COVID unit ranges from 47 to 88 years of age. Of our patients in the COVID unit, 9 out of 13 are unvaccinated. And of those 9, they are all on high flow oxygen and very ill. 11 of the 13 are from outside the Santa Fe area. For us, this has been a surge in hospitalization of non-COVID patients. It's patients seeking much needed care that they may have delayed or been afraid to come to the hospital for. So that too is putting a big stress on our entire system. We're still conducting our drive-through testing Monday through Friday and currently doing more than 200 tests per week. We're offering monoclonal antibodies in our institution, and we're offering third doses of Moderna and Pfizer to our immunocompromised patients. We're also following the public health order vaccine mandate, and at present, 95% of our staff has been vaccinated. And I want to stress as well, our vaccines are very safe. Most hesitancy is in the 18 to 49-year-old population, and that's reflected in our hospitalization rates. And despite almost 400 million doses being given in this country with exceptional safety, there's still some hesitancy. So I too urge everyone to get vaccinated.
Thank you, Dr. Gonzalez. We'll go ahead and open it up for questions. If you have a question, please let me know in the chat and I will call on you. We'll go ahead and start with Matt Grubbs from New Mexico BBS.
Hi, thanks, Mark, and thanks to everyone. Really appreciate what you're doing. A couple of questions on basically populations. One is of patients. Dr. David Gonzalez mentioned that you're seeing people from outside the Santa Fe area. I'm wondering if you all have answers to whether you're seeing people from out of state, Texas, Oklahoma, that sort of thing. And then also I'm wondering if you have actual numbers on medical workers who have either chosen to quit, been fired, or furloughed as a result of the vaccine mandate. Again, thanks very much.
I'll go first. Yes, starting with the medical workers, we had about 200 employees who had not been vaccinated yet, and about 130 of them came forth last week and we vaccinated them. We still have about 90 employees who work in various areas of the hospital, and recall that also includes contractors, people who come to the hospital on occasion who receive the exemption. And therefore, those 90 folks will have to be tested on a weekly basis. And as far as out of state, yes, we have seen patients from out of state. We've seen patients from Texas, Oklahoma, and we have had patients from the southern part of the state, Carlsbad, Hobbs, and Lovington.
Regarding the patients coming from outside of the state, we've looked at that at a state level, and it looks like the net flux of patients is we send more out of New Mexico than are coming into New Mexico from outside of the state. But certainly it feels different for those of us who are practicing. I've felt like I've seen more out-of-staters in the ICU, but that's the experience of one person. When we do look at the net data, we are sending more people out of New Mexico than are coming in. The experience is also very varied across the state. In the first few waves, we had higher numbers in the Northwest and the North in New Mexico of COVID cases. And now we're seeing much higher rates in the Southeast. That can all be linked to vaccination rates. But there is a very varied experience across the state. We're not all experiencing the same thing. That's why Dr. David Gonzalez mentioned seeing a lot more patients coming in from southern New Mexico going up to be hospitalized in the north. And it has to do with the very large case counts that are occurring in those lower vaccination rate parts of our state. With regards to the vaccine mandate for Presbyterian, fortunately, the vast majority of our workforce was vaccinated prior to the deadline. And we currently have at least 97% of our entire 13,000 employee workforce either vaccinated or with an approved exemption?
As far as Loveless, we're in the same situation. We're very close to 100% with either vaccination or exemptions, and very small numbers of nurses or other healthcare workers have left the system. So everyone is complying with the mandate and will continue to do so as we move ahead.
At UNM Health, we have over 95% of our staff that are fully vaccinated or exempt under the public health order. We have had a few employees who have made the decision to separate from the organization at this time, and we really appreciate their service and thank them for their work. We can say that those employees do not, based on those employees leaving, we do not anticipate that we will have significant staffing shortages either in the nursing arena or anywhere else. Having said that, just to be clear, there is a nursing shortage, but it's not going to be worsened by this very small population that have decided just to part ways with our organization.
Thanks, Matt. Next, we'll go to Julia Goldberg with the Santa Fe Reporter.
Thank you, Mark, and thank you, doctors, for your time. I had two questions. I wondered if there's any commonality in terms of the non-COVID patients. What are some of the most common issues, sort of healthcare issues that you're dealing with that people had put off care for? And then I also know last time we spoke, you had mentioned that there are interventions with non-vaccinated people when they're in your facilities, in terms of talking to them about getting vaccinated. I'm wondering if you are hearing any, I guess, common threads from people who haven't been vaccinated about why they did that, if some of those concerns are ones that can be addressed in your facilities. Thank you. I'm happy to repeat all of that if none of it made sense.
So I can answer the first part of that question because we have looked into this and we find that we have a higher number of trauma patients. As you know, as a level 1 trauma center, we get a lot of the critically injured patients and we're seeing higher numbers of those. That is driving a lot of our high census. We're also seeing patients admitted with liver disease, sometimes related to alcoholism, sometimes not. And so those two categories of patients are driving our non-COVID census. In terms of anecdotally, we don't have data on this, but anecdotally, the reasons for not getting vaccinated are same as what you hear from the community, which is I was either waiting for full FDA approval, or I was hoping that enough people around me would be vaccinated, or I thought that the vaccines were rushed. And so we do our best to reassure these patients, as we do to everyone, that the technology behind these vaccines has really been around for 20 years. And so the vaccines have been scrutinized and studied more than any other vaccines in our history, and are perfectly safe. So it's the same themes that we see in the community that we're seeing amongst our unvaccinated patients.
The commonality that we're seeing in both COVID positive and non-COVID patients tend to be obesity, as well as diabetes and certain immunocompromised conditions. Our hesitancy that we've been seeing in the inpatient setting from those patients that haven't been vaccinated are the same as just mentioned. They're still weary of a vaccine that hasn't been FDA authorized, although we're there now. Also, they're hoping that other people would be vaccinated, or they didn't think they could get it. And so therefore, important that everyone be vaccinated. And we still continue to offer monoclonal antibodies to people who are at high risk, who've had an exposure, a post-contact exposure, and also to those who are COVID positive.
At Presbyterian, we're seeing delays in care for people with cardiac conditions and neurologic conditions, as well as cancers that either weren't detected during routine screening and now are much larger and later stage in terms of their presentation. So we've been dealing with that backlog of patients for our non-COVID. Amongst the COVID, the demographic seems to be shifted to a younger population because I think the younger population has more vaccine hesitancy. And lastly, it's very heterogeneous. Higher vaccine rates in the north and central New Mexico, much lower vaccine rates along the eastern border of our state.
Thanks, Julia. Next, we'll go to Jackie Kent of KRQE, and after Jackie will be Ryan Botel of the Albuquerque Journal. Go ahead, Jackie.
Hi, everyone. Thank you for your time today. Can you all speak to your typical hospital capacity, usually, in a non-COVID year, usually 85% full or whatever it may be before COVID, and how the, the surge obviously is pushing you over the edge, just to give people some perspective. Thank you.
Yeah, Jackie, hospitalization rates tend to be seasonal. Also depends on the type of hospital. So you're about to hear us each report something that's going to be slightly different, and it has to do with the specialization that we have. So typically the summer months are some of our lowest capacity times, but even at that, we generally run around 90% full across most of our care areas.
And I think what we're seeing through our level system is that typically we would have, a month period of time where our census would dip and a little bit of rest for everybody. This just has not occurred. There hasn't been a let up at all in the types of patients, the acuity of the patients, the number of the patients, whether it's COVID or not. And so this has just led to a continuous stream of patients coming from all over the state. And I think that that's also important to understand, is that here in central New Mexico, we're receiving patients from all over the state, from the smaller facilities that are also very full and also dealing with a high acuity of patients. So it's an influx of patients that has continued from all corners of the state.
We too are seeing maximum capacity, and this surge of, especially of non-COVID patients, actually started about 2 to 3 months ago, and it just continues on a daily basis. So we've been at a near or above 100% capacity for some time now. As Dr. Gonzalez mentioned, it's usually seasonal, and this usually is a time where we have a slow period, and that has not been the case this summer. The one thing that does concern me is that we're starting to enter influenza season. And I hope that people take this very seriously and get the influenza vaccine as soon as possible. Last season, we saw very little influenza, and that was because we were all masking and therefore very few cases. But this year could be different, and I hope people don't get casual about not receiving the vaccine.
So at UNM Health, because we are a level 1 trauma center, typically during the summer, we see higher trauma census. And then as that starts to wane and RSV and flu season kicks in, we see our pediatric census go up. And normally we're pretty full. We're above 90%, close to 100%. And we've been running between 120 to 140% over the last few months, because we haven't seen the normal cycling through the seasons because of all the delayed care that we have been catching up with.
Thanks, Jackie. Next, we'll go to Ryan Botel of the Albuquerque Journal. After Ryan will be Stephanie Muniz of KOAT. Go ahead, Ryan.
Hi, thanks, Mark. Thank you, doctors, for talking to us today. I wanted to go back and try to understand a little bit better what effect the vaccine mandate has had at your institutions. Because, like, for example, Dr. Gonzalez, you had said that Presbyterian's about 97% vaccinated, but with 13,000 employees, 3% is about 400. So, I mean, are we looking at, like, is that about how many people lost their jobs at Presbyterian? And what exactly has happened to healthcare workers that weren't vaccinated? Have they all been fired at this point? Are they suspended? Do they have an opportunity to get their jobs back if they do get vaccinated? So I was just kind of wanting to clarify that, because I think Dr. McKee, you said 5% of UNM isn't vaccinated. So have you lost about 5% of your workforce? Thank you.
Well, Ryan, I'll answer the first part. Presbyterian takes vaccination very seriously, and that's why we required it of everyone who works for Presbyterian. Not all 13,000 are doing direct patient care. This is also counting people who work in the back office and who never see patients. But we feel that it's very important, and that's why we followed the mandate, including those employees. Employees who haven't been vaccinated or received their exemption for the vaccine will be placed on personal leave. So they still have the opportunity to become vaccinated and to return to the workforce and continue to work for Presbyterian.
So at UNM Health, we take the public health order very seriously, and we are following it very closely. We do our very best with all our employees who are not vaccinated to try and understand what their concerns are and address them if possible. With the kinds of numbers we are dealing with, this is a logistically challenging situation. We have a number of people on FMLA, for example. We have a number of people who don't work full time or who may be on extended leave for a variety of reasons, and we're working with them as well. But above all, we have to follow the public health order. We give them, our employees, every opportunity to be compliant, and then we follow progressive disciplinary action. And if they choose to separate from the organization at this time due to lack of vaccination, then that is their decision. If they then choose to get vaccinated in the future, they are certainly allowed and welcome back to work at UNM Health, but we have to follow the public health order, and that is what we are doing.
At Christus St. Vincent, we had about 90 employees who received the exemption, and thus far we have lost 2 traveler nurses who have decided to work out of state. And we put people on personal leave, and we continue for those who receive the exemption to do weekly testing. I want to stress, though, that at all our institutions, the mask mandate indoors is still in effect. And it's in effect because it allows us to keep both our employees and our patients safe.
And at Loveless, we are following the public health order very closely. We have a percentage of employees that have asked for the exemption, so they will be tested. And we've had very small numbers, I believe 4 or 6 people that have decided to leave the organization and not wanting to comply. People have been very responsive to the vaccination and the public order. I think they understand the importance of this. And so it has been generally well received within the organization.
Thanks, Ryan. Next, we'll go to Stephanie Muniz of KOAT. After Stephanie will be Colton Schoen of KOB. Go ahead, Stephanie.
Hi, everyone. Thank you for taking time to do this today. I have two questions. The first is, which hospitals are doing the outpatient therapy treatment like Regeneron? Of those, why not? The second part of my question is, in yesterday's press conference, it was mentioned that hospitalizations within COVID patients are expected to jump to about 700 a day. With these current trends right now, how are you guys preparing to get that influx of more COVID patients? Thank you.
We are offering the monoclonal antibody therapy as an outpatient through our infusion center, as well as some of the facilities through the emergency room. It's exceptionally important that if people are positive and they have the risk factors, they seek out the therapy at some facility close to where they're located. And the reason why is because it's so effective at preventing hospitalizations. So again, it's very, very important that people, if they are positive and have those risk factors, they seek out the therapy, because it may be our one opportunity to prevent them from going on, becoming ill, and being hospitalized.
So
I'll just add that the timing, I'm sorry, Rohini, go ahead.
Thank you. Sorry, Denise. So at UNM Health, we are offering monoclonal antibodies to patients in the outpatient setting. And as I've said here before, we have a pandemic influenza plan that will allow us to change our operations in a way to accommodate an influx of patients. The state modeling does show us that our cases will peak sometime next week. And as we know from our previous surges, the hospitalizations and deaths lag at least a couple of weeks behind the peak of cases. And so we anticipate that late September will be the peak of hospitalizations for this particular surge, and then it should subside after that. But we are prepared to do that, as we have in the past, by converting what have traditionally been outpatient areas to inpatient care. And there are a number of other strategies that we employ within our pandemic influenza plan to meet the needs of the community.
I just wanted to add that timing is very important. It has to be administered within 10 days of symptom onset. So don't delay, please. And we're really following the science. I think we're almost all exclusively using Regeneron because we know that it's the most effective against this Delta variant. And so please seek out that help if you are COVID positive, so that we can administer Regeneron and hopefully keep you well enough to stay out of the hospital.
At Krista St. Vincent, if we do experience that surge that was just mentioned, we have the capacity to increase our bed capacity by basically doubling up and making semi-private rooms. We also have other units that we could convert to patient rooms, since there's our clinical decision unit and other units. We do as well continue to offer Regeneron to those subgroups who qualify for it. I do want to stress to the public, though, that the monoclonal antibodies is not a substitute for a vaccine. We do have a very effective therapy to prevent serious COVID illness, and that's called the vaccine.
Thanks, Stephanie. Next, we'll go to Colton Schoen of KOB. After Colton, we'll go back to Ryan Botel of the Albuquerque Journal. Go ahead, Colton.
Hi, good morning. Looks like I logged into Spencer's Zoom by accident. But yes, Colton Schoen here. My question is about the different variants that we're starting to see. I know right now the Delta variant is pretty much behind the surge here, but WHO talking about the Mu variant, which has shown some possible vaccine resistance. How closely are the hospital systems here in New Mexico watching this, and could this potentially disrupt everything that has already been put into place when it comes to fighting coronavirus, in the next few months, if we see another potential surge in this or other variants?
Colton, I think it's important for us to all remember that coronaviruses are very mutagenic. They change a lot and they're everywhere. And we'll continue to track to see if in fact any new variants are resistant and if they do cause serious illness, and in which case we'll rely on this great technology of the mRNA vaccine to be able to pivot quickly so that we can cover it if in fact it is resistant to existing vaccines.
Colton, I think the emergence of the mu or the B1621 strain that the WHO is now watching closely illustrates just one really important principle. There are two things that will determine the course of this pandemic: human behavior and virus behavior. And human behavior will influence virus behavior. And so the longer we remain unvaccinated and the longer we resist masking and social distancing, the more we're going to see some of these extremely dangerous variants emerge. Now, this particular new variant has been shown so far to not work as well, even in the vaccinated or in those who are recovering from COVID. We are still doing studies, the WHO is still doing studies to confirm whether it will really prove to be more contagious or more deadly. But it is a variant of extreme concern. It was found in Colombia and now makes up about, I think, 7 to 9% or so of all the cases in Miami. And it really illustrates the need to get vaccinated and to engage in the behaviors we know to be effective, because we are currently losing the race between vaccines and variants. And I think the emergence of this variant should really cause, especially those of us who have chosen not to get vaccinated yet, to pause and think about whether we want to go right back to step one. If this is indeed able to escape the vaccines, do we want to go back to March of 2020? And I think that's the question we need to ask ourselves.
Thanks, Colton. Let's go back to Ryan Botel, the Albuquerque Journal.
Hi, thanks for letting me ask another question. Dr. McKee, I wanted to follow up with something that you said. I believe you said you expected COVID hospitalizations to peak in late September for this surge and then taper off. I was just curious why you health officials are expecting the COVID surge to taper off in late September as opposed to last year. Didn't we just sort of see cases rise throughout the fall and winter? Just wondering why it is expected to be different this time around. Thank you.
Thank you, Ryan. Let me clarify. Based on state modeling, it looks like our cases are plateauing. It's looked like that for the last few days. But if you look at the state modeling, it does say that our cases are going to peak sometime in the next week or two. Knowing what we know about this coronavirus, we know that hospitalizations and deaths lag 2 to 3 weeks after the peak. So if you just follow that timeline out, then in the absence of any further variants, we would expect to see a peak of hospitalizations towards the end of September. And as you know, on average, those patients stay in the ICU for 2 weeks, sometimes 3 weeks. And so beyond that, in the absence of any other variants, we would hopefully see the cases start to taper. But as we've seen, there are curveballs around every corner with this pandemic. And this would be under circumstances where human behavior is, following certain public health guidelines, and in the absence of new variants that we can expect to see that timeline. So I hope I clarified that.
Thank you very much.
Thanks, Ryan. And I don't see, did anybody else, I just got logged off for a second. Did anybody else have a question after Ryan? If you do, just let me know in the chat.
Mark, I think there's a question from Univision.
It is, yep, Myra. Myra Aguilar from Univision. I believe that will be for you, Dr. Gonzalez. Go ahead, Myra.
Hi, everyone, and thank you for taking your time to do this. My question is for Dr. Denise Gonzalez, and it's about yesterday's press conference, and I just wanted to clarify and get some numbers regarding the Latino community. Doctora, quería preguntarle, durante la rueda de prensa el día de ayer se dio a conocer que algunos de los números más altos de personas que no se quieren vacunar son latinos, son hispanos. Quería saber si entre esos números también el número de hospitalizados y el número de fallecidos también concuerda con eso, si también son latinos y hispanos. Y segundo, ¿qué es el mensaje a la comunidad latina que aún no quiere vacunarse o tiene miedo o por cualquier otra razón no se han vacunado? Gracias. Thank you.
Sí, claro, Mayra, por su pregunta. Sí es cierto que la gente hispana no se está vacunando. Quizás es por razones de inmigración o de ciudadanía, o quizás son por las mismas razones que otros dan, que no es aprobada por el CDC. Ahora sí es aprobada la vacuna contra COVID. Y por las mismas razones que la gente que está en los hospitales hoy son los que no tienen la vacuna, y teniendo hispanos que no se han vacunado, claro que los números de las personas que están en el hospital, en cuidado intensivo, en ventiladores, son más de gente hispana porque no se están vacunando. Es muy fácil, vacúnese. Por favor, mi gente, vacúnese. Protege a sí mismo, a su familia y a toda su comunidad.
Muchas gracias, doctora.
Claro.
Thank you, Myra. Does anybody else have a question? If you requested it after Myra, please let me know again. I got logged back out, but I should be able to see the chat now. Does anybody else have a question before we bring this to a close today? Okay, seeing none. Thanks again, everybody, for joining us this morning. Once again, if you need a copy of this recording, please let me know and we'll get that to you. It's also on our Facebook page at UNM Health Sciences if you need a copy of this. Thanks, everyone.